Hey, good day and welcome to UroNurse. I'm Vic Senese, bringing you the latest updates in urologic health and oncology today. Today we're looking at a major topic from 2026 ASCO Genitourinary Cancer Symposium. Are combination therapies becoming the future standard of care for kidney and bladder cancer? New phase 3 clinical trial data presented at the meeting suggests that combining treatments may significantly improve outcomes for patients with renal cell carcinoma, or RCC, and muscle-invasive bladder cancer, also known as MIBC. But while the data is exciting, experts say we're not quite at the finish line yet. So let's break down what the research is telling us. First, let's talk about clear cell renal carcinoma. It's the most common form of kidney cancer. Until now, no phase 3 trial has shown a clear survival benefit for the combination therapy in the adjuvant setting, meaning treatment given after surgery to prevent recurrence. That may be starting to change. At ASCO GU26, researchers presented results from the LIGHTSPARK-22 trial, which included more than 1,800 patients who had recently undergone surgery for high-risk kidney cancer. Patients received either pembrolizumab plus belzutifan or pembrolizumab alone. That's Keytruda, easier to say. While the study is still early, investigators reported clear separation in disease-free survival curves, meaning patients receiving the combination therapy appeared less likely to have their cancer return. The hazard ratio ranged between 0.59 and 0.87, and the findings were statistically significant. That makes this the first adjuvant RCC trial suggesting a benefit from a combination therapy. Lead investigator Dr. Tony Chiariri from Dana-Farber Cancer Institute said the results may support a new standard of care for patients at high risk of recurrence. However, there are some caveats. Overall survival is still immature, and combination therapy was associated with higher rates of anemia and hypoxia, along with a slightly higher rate of treatment discontinuation. Experts say we need longer follow-up before making definitive treatment changes. But this is still huge, folks, because I can tell you when I went into practice, it was surgery or nothing. Another study presented at the meeting looked at advanced or metastatic kidney cancer. The LIGHTSPARK-11 trial tested the combination of belzutifan and levantinib compared with the current targeted therapy of cabozantinib. The results were impressive. Patients receiving the combination therapy had a mean progression-free survival of nearly 15 months, compared with about 11 months for the cabozantinib. Even more striking, the duration of response nearly doubled with the combination therapy. At 2 years, almost half the responding patients were still benefiting from therapy. Study investigator Dr. Robert Motzer from Memorial Sloan Kettering said the findings could represent an important new option for patients whose cancer has progressed after immunotherapy. Still, experts caution the treatment decisions must remain individualized. As one commentator noted, this is not a one-size-fits-all solution. Now let's shift to muscle-invasive bladder cancer, where combination therapy results may be even more dramatic. In metastatic disease, the combination of enfortumab, vedotin, and pembrolizumab is already considered the standard of care. But researchers have been asking an important question. Can this approach work earlier in the disease process? The Keynote B15 trial suggested the answer may be yes. This phase 3 study compared the combination therapy with standard chemotherapy using cisplatin and gemcitabine in patients planning to undergo radical cystectomy. The results showed significantly improved event-free survival, better overall survival, and a much higher pathological complete response rate. In fact, more than 55% of patients receiving the combination therapy had no detectable cancer at surgery, compared to with just 32% in the chemo group. Experts described the results as practice-changing. One ASCO specialist even called the finding a slam dunk. Another related study, the Keynote 905, looked at patients unable to receive cisplatin and chemo. Here again, the combination of enfortumab, vedotin, and pembrolizumab delivered strong results. Patients receiving the therapy had dramatically higher rates of tumor downstaging and significantly longer disease-free survival compared with surgery alone. Taken together, the two trials suggested this combination therapy may work regardless of whether patients can tolerate cisplatin. So what's the big takeaway from the ASCO GU 2026? Combination therapies are rapidly reshaping the treatment landscape for kidney and bladder cancer. In renal cell carcinoma, we're seeing the first signals that adjuvant combination therapy may reduce recurrence risk. And in muscle-invasive bladder cancer, combinations involving antibody-drugs, conjugates, and immunotherapy may soon redefine perioperative treatment strategies. But as experts remind us, longer follow-up and additional studies will be essential before these approaches can become universal standards of care. For clinicians, nurses, and patients alike, this message is clear. The era of combination therapy in urologic oncology is just getting started. Hey, tomorrow on UroNurse, Botox for erectile dysfunction? It may sound surprising, but researchers are now exploring whether botulinum toxin injections could help men with treatment-resistant erectile dysfunction. Could a therapy best known for its cosmetic treatments and bladder disorders play a role in male sexual health? Tomorrow, join me as I break down the latest research, potential mechanisms, and what urology professionals need to know about this emerging therapy. Is this the next frontier in sexual medicine or still experimental? Tune in to UroNurse tomorrow and stay informed on the latest developments in urology, men's health, and sexual medicine.
Breaking news, clinical guidelines, and research insights delivered weekdays at 9 a.m.
UroNurse, where the experts meet. Online learning, practical and sweet.